Dr. Therian here, and if you're watching this video, it's likely that we just talked about a welder's burn or flash burn or photokeratitis during your eye exam. Now this video doesn't replace the need for an eye exam, it just supplements what we kind of talked about and reinforces what was explained during your eye exam. And so what has happened is from being out snow skiing, from being around welders a bunch, we've basically gotten a sunburn on our cornea, a sunburn on our eye. And so what I see as a doctor in these situations is redness, maybe a little bit of swelling, but that cornea, the very front part of the eye where a contact lens would sit, it looks really inflamed, really scratched up, really ticked off. And so the treatment that I usually do with this is artificial tears, cool compresses, and time. Most of the time these things will fix themselves in 24 to 72 hours on their own. So in a day to maybe 3 days for the fix itself. And so what we really need is time. We don't need cut potatoes, we don't need milk in the eye, we don't need a cat to lick it. That was the craziest one I've ever heard. Those situations, it's not a clean, especially the cat's tongue, it's not a clean thing. It is a situation where we're introducing bacteria to the area and it increases the risk of infection. And so if these things happen and they're just mildly irritating to you, artificial tears are gonna be your best friend in a little bit of time. If it's really bothering you, come in, let an eye doctor take a look at it, because what we can do is, put an antibiotic on it if we need to, if we're worried about infection, put a steroid on it to kind of calm things down, maybe even dilate you to take away some of that pain, or in extremely bad cases, we'll even put a bandaged contact lens on there. But the bulk of the times when I see this, it's nothing to worry about. I just tell patients, eat more vitamin C, drink more vitamin C, and use some artificial tears for a couple of days, and you'll be right as rain pretty quick. And so, as always, this video doesn't replace the need for an eye exam. It's just supplementing what we talked about. If you have any real questions about this type of stuff, reach out to an eye doctor near you and we'll get you taken care of.